Welcome to everybody. In this video I'm going to talk about the bladder, the urinary bladder. First of all, we'll talk about the definition. The urinary bladder is the organ that collects urine excreted by the kidney before disposal by urination. In this video we can see the cystoscopy and the biopsy of the urinary bladder. This is an ureteroscopy. We are penetrating in the urethra to reach the urinary bladder. In the rest of the video we can see how is the structure in the bladder. So we can pause. This is an anterior bladder wall, and we can see how the structure, how the anatomy and histology, microscopy on the urinary bladder. This is the next lateral wall of the bladder. Well, continue. In this another video, we can see an example, another cystoscopy, the urinary bladder.
Your doctor will perform a cystoscopy to diagnose conditions of your urinary tract. Your urinary system, or urinary tract, produces urine and excretes it from the body. It includes the kidneys, ureters, bladder, and urethra. In men, the prostate gland wraps around the urethra at the base of the bladder. As blood circulates, it passes through the kidneys, where wastes and extra fluid are removed to create urine. The urine then moves down the ureters to be stored in the bladder, an expandable balloon-shaped muscle. During urination, urine leaves the bladder through the urethra and is expelled from the body. By allowing your doctor to view the interior of the urethra, bladder, and the openings of the ureters, a cystoscopy may reveal the following conditions: an unusual growth such as a polyp, cyst, or tumor, a stone in or near the bladder, chronic inflammation or infection, a stricture or narrowing of the urethra, enlargement of the prostate gland, or ulcers in the bladder wall. Before your procedure, an IV line may be inserted into your vein to provide medication. Your doctor will begin by applying a local anesthetic to numb the area.
So in this video we could see how is making the cystoscopy on the urinary bladder. Okay, continue with the application of the urinary bladder. I mean, what is the uses for this important organ? First of all, quantify the ring helps to find the pathology causing the damage. For example, less than 50 is considered an URI, less than 50 between 100 and 150 is considered a URI. More than 50,000 is considered polyuria. Of course, those numbers are relative. And problems like this URI, that is a pain emission, determines the location of the problem. First of all, in the low of the urinary bladder. This is another video about the bladder infection.
Urinary tract infection is an infection of the urethra, the bladder, or both. The urethra is a tube that carries urine from the bladder outside the body. The bladder and the urethra are part of the urinary tract system. That is why a bladder infection is also called a lower urinary tract infection. If you have a bladder infection, you often feel a burning sensation while urinating and a pressure or painful sensation in the lower abdomen. You often feel that you have to urinate, but not much urine comes out during urination. The urine may have an unpleasant smell and may sometimes have blood in it. The most common cause of a bladder infection is a bacteria that infects the bladder mostly through the urethra. There are different factors that increase the chances of a bladder infection, which goes along with increased risk of bacterial infection. Not enough fluid intake, sexual intercourse, bad hygiene, bladder or kidney stones, pregnancy, menopause, diabetes mellitus, if you have a catheter, birth defects of urinary tract or kidneys, chemicals. Women have bladder infections more often than men because women have a shorter urethra, causing easy entry of bacteria from outside into the bladder. Even though it is often thought, it's not likely that a cold or draft can cause a bladder infection. A bladder infection is an annoying and painful complaint that in general can be treated well. The GP may prescribe antibiotics to speed up the recovery of a bladder infection and prevent complications like an infection of the ureter, kidney, pelvis, etc. To prevent bladder infections, it is important to drink 2 liters of water daily. Frequent urination washes out the bacteria. Don't resist the urge to urinate, but go to the bathroom as soon as you feel it. Always make sure to completely empty the bladder when urinating. For some women, a bladder infection recurs less frequently if they urinate after having sex.
Okay, that was the video about infection. Principally, one of the problems more common in the urinary bladder. About the location, the bladder is sits on the pelvic floor. Urine enters the bladder via the ureters and exits via the urethra. Interstitial cystitis is a common problem of the urinary bladder. Our bladder pain syndrome is a chronic inflammatory condition of the submucosal and muscular layers of the bladder. The cause of interstitial cystitis is currently unknown, and the condition is regarded as a diagnosis of exclusion. It may be associated with urinary urgency, urinary frequency, waking at night to urinate, called as nocturia, and steadily urine cultures. Those with interstitial cystitis may have symptoms that overlap with other urinary bladder disorders such as urinary tract infection, overactive bladder, urethritis, urethral syndrome, and prostatitis.
Welcome to Healthy Nation. I'm Dr. Holly Atkinson. Experiencing the loss of bladder control because of a sudden urge to urinate can be embarrassing, and it may keep you from enjoying the activities that you love. The problem is,
as in other videos, we can play or increase the knowledge visiting my pressic.com with the complete videos of the performance. This is another video about the urinary bladder of Healthy Nation. We can see this video completely in my www.percy.com. Write down in the description of the video. Thank you.